tested positive thus far today I should say, to 38,497. So those 443 cases are on 6,621 new tests, bringing
431 new cases.
347,647 tests.
Wow, that's over a 10% success, positive rate on tests.
Ranking of the states changed from per capita cases. We are now number 9, so we moved down another slot.
Oh, we're number 9. So we should definitely not be reopening.
Country in per capita cases. I'll also point out, because we didn't have our press conference on Memorial Day, the recovered is now estimated at 28,700. So
that's nice.
That's about 10,000 active COVID-19 cases based on tests. That number has been remarkably steady for at least the last month or so.
So nothing's changed with the number of people sick?
There are a number of individuals out there who have COVID-19 who've not been tested.
And more people have COVID-19 than we know about, of course.
10,000 cases.
So why are we proceeding with phase 1 reopening?
Somewhere between 25 and 35% of people with COVID are totally asymptomatic or so mildly symptomatic that they're likely not to be tested and show up in those test numbers.
And all those people will spread the virus everywhere.
And our cases, one of the things that we look at is the percentage of positivity among the tests that we administer. And the World Health Organization and the CDC have a goal of 10%. If you're below 10%,
we are not below 10%.
If you're above 10%, you've got a ways to go. I think if you look at the total number of tests administered and total number of cases, it's about 11%. But you got to remember that weeks ago, we were testing people who were in hospitals almost exclusively, and so our test positivity rate at one point was in the 40s. I think so. It's
and his math is off. It's more like 14%.
More recently, at a daily number on positivity, they've all been below 10%. Today was 6.7%. Yesterday was 2.4% on more than 10,000 tests. And so we're doing relatively well on that.
We won't see the spike in numbers from these few days. It's going to take 2 weeks before we know how reopening the way we have, but it's done. This is not good news. This is just like patronizing business community and economic ideas. If people act on this, they will spread this disease.
Our testing goal for May was 200,000. As of today, in this month, we have tested 179,369. So that leaves about 20,631 tests that we need to administer over the last several days of May in order to get to that 200,000 level. That's a little over 5,100 tests.
I think I need to get a test. I've been close to the tabernacle too long. So maybe I should take the governor's advice.
Doing the mobile testing across the state, so we think we're going to get to that 200,000 tests, which is 4.3% of the state's population. So that's a critical.
4.3% of the state's population. It should be like 90%.
That's recommended by the federal government.
Who cares what the federal government recommends? Let's look at like, I don't know, South Korea, where they tested everybody and did contact testing. Wasn't 4%.
We're ramping up testing.
If you're not testing 50%, you're not going to get anything close to a real statistical average on this. A 4% sample is ridiculous.
Both with respect to residents and staff. And in those settings only, the CDC recommends for sentinel surveillance, I think is what
I'd also like to note that the governor and his translator are not wearing masks.
Unfortunately, today we are reporting new deaths, 21 of them, which brings the
21 new deaths today. 2,617 people are dead because of the failures of our government to keep this out of our lives.
And that number today is 798. This is the first time in 2 full months that we've dipped below 800. So even as the cases increase,
you're making up happy statistics.
Decreasing. 100.
And we all have to remember these are absolute minimum numbers. they don't count all kinds of people that died, we won't know the revised incorrect results for a long time. Working off minimum estimation should always be treated with large margins of error.
Around the country, and I think most of the early schools came out of New York City. But according to the Centers for Disease Control, MISC, which is the acronym for multi-system inflammatory syndrome in children, is something that is real, and it's happening around the country, and it's happening here in Louisiana. Obviously, like its name would indicate, it's a condition in children where different body parts can become inflamed, including the heart, the lungs, the kidneys, brain, skin, eyes, gastrointestinal organs.
Is this
And we don't
Kawasaki
yet
disease?
know exactly what causes it, but we know there is a relationship to the virus with these children, that they've had it, or that
This is a
they've
terrible way for
in
children to be
contact with
sick and
someone who
dying
actually had COVID-19
because of
disease.
COVID-19.
And it can be serious, and it can be deadly.
Of course it can.
Most children
This is
who
a
are
serious,
diagnosed
deadly
with this
virus.
condition, do get better with appropriate medical care.
We're reaching 100,000 people dead in this country.
Of an MISC case, the individual has to be under the age of 21 with a fever, evidence of inflammation, and severe illness involving more than 2 organs that requires hospitalization, and no other plausible diagnosis, and then a positive COVID-19 test or exposure to a confirmed case within the 4 weeks prior to the onset of symptoms. So when we talk about this particular syndrome, that's what we're talking about. I do want you to know it's
That
in
seems like a
Louisiana.
very
That's why
stringent
the
amount of protocol when people should be being checked. Children should be checked with even just
the state,
a small selection of those.
and then again on May the 15th. These alerts raise awareness of MISC and urge providers who care for or are caring for currently patients younger than 21 years of age and meeting these criteria to immediately report them to
The governor is
Office of
not
Public
handling
Health.
this correctly anymore. He was being so positive, doing things right, and now he's trying to make up all these positive
13
facts
confirmed cases of MISC across
that
the state of Louisiana.
don't matter, and now he's bringing up one of the most terrible problems caused by COVID-19 right after he gave a bunch of false good news in order to soften the blow of this horrible thing that's happening to kids. 13 confirmed cases in this state.
0 to 19. The median age is 11.
The
6 of the
median
patients
age is 11 years old for these kids.
4 are hospitalized. 8 have been discharged. In terms of race, 7 are black, 3 are white, and 3 fit in the other category.
Or they all are human, and race isn't a real
2 are
thing.
Hispanic and 11 are non-Hispanic.
Again,
For
human.
context, we know
There's one race of humans, Homo sapiens sapiens.
cases tested.
Name so great, we gave it to ourselves twice.
Individuals who were
We are humans. The color of our skin is just like skin tone, not race.
on Mondays and its coronavirus webpage.
People need to stop thinking of things in racial things.
I will
It's
wait
not
for
races versus races. It is
press conferences.
the poor versus the rich. And if you're not rich, I mean the top 10%, you're poor. And if you're in the bottom 10%, living in poverty, you are being robbed by everyone at every chance. They take all the money you make. That is what the conflict is. It's against the people above us, not people's races.
If a taxpayer cannot remit the sales tax and interest by June 30th, they may still be eligible to have the penalty relief if they can enter into an installment payment agreement by June the 30th.
Okay, that's nice.
So
Some
at this time,
financial
I've got a
incentives.
couple of questions from the public that we will entertain, and then we will take questions from those of you here.
All right, question time.
And Lake Charles, is there any need for people with no symptoms to get tested? And if we're negative, do we need to get retested at any point? Well, as I mentioned earlier, we're still following the CDC guidance, which is not for the general public to be tested if they are asymptomatic. there is asymptomatic testing as part of our surveillance program in congregate settings. So in places like these labor camps or jails, prisons, nursing homes. And that goes.
What about
for
protesters that
patients
have had to
and
be too
staff.
close to people or been approached by COVID, potentially COVID infected people? I think I need a, I want a test. I'm asymptomatic.
Encouraging them to get tested. I will tell you that anyone who receives a negative test, that means that they are negative on that day.
Yeah.
It does not mean that they won't become
Only a
positive
positive
at some point
test
in the
is an
future.
actual result. A negative test is not. And antibody tests are at least 50% false positives.
Is important,
So
but it's,
this
it doesn't mean that you won't get it.
a negative test will never be something you can trust.
Negative, but then subsequently develop symptomatic, symptoms that are consistent with COVID-19, you need to be tested again. Rosa in Shreveport wants to know if it's safe to eat in restaurants.
It's not.
Well, the way that we
I don't care about how much social distancing there is. If you're in an enclosed building,
for restaurants to
6 feet
operate
apart of people,
both, inside at 25%,
no.
with
If you're
social
outside,
distancing, and
sure.
outside, with social distancing, it is safe.
No, it's not
Obviously, we're
safe.
safer at home, and the message for any individual who
It's
is
just, that's just pandering to the business community again,
comorbid health condition. Again,
instead of doing the right
hypertension,
thing
diabetes,
and
heart disease,
keeping every place closed,
those things.
giving people temporary funds to get through this time until we can actually close the end the pandemic, and then people can reopen.
And you eat, and individuals who are serving you and the employees have their masks on, and you wear your mask to and from your table, and you're sitting with individuals who are from
You
your
should only be
immediate
served
household.
once. You shouldn't
You
have
can't do that
reservice.
safely. And so
They should serve you and then sanitize and then only serve another person, and
and again, wearing that
you have to get
mask
your own
protects
drink
others
refills.
from yourself, and
or have new glasses
mask
delivered
that
every
they
time.
wear
Actually, that's the
themselves.
smartest thing to do.
And what we've learned from the Centers for Disease Control is they now believe that the vast majority of cases are contracted not because people are touching surfaces where the virus is, but through airborne particles.
No kidding,
that
it's air.
contain,
This
the
thing
virus,
can stay
and so
airborne
it's
for
being
ridiculous
spread
amounts
to
of
people
time
talking
compared to
about
most
coughing,
coronaviruses.
if you cough or sneeze, and that
Especially
sort of thing, that's why
inside.
that face covering,
Outside, the UV
is
light
so
kills,
important.
a lot.
So I wanna
UVA
thank,
and B is good. It's not like we have UVC
Rosa
for
their
sterilization.
questions. And I'll
The
thank you
atmosphere
in
doesn't let
advance.
that in, but
Before we do that, did you
that's a
want to
terrible
see
answer to that
list of
question.
questions? Okay. So with that, we'll take your questions now as well. Craig?
You're either in the middle or you're at the end of the 14-day period where you're analyzing the data and the trajectory of.
Are you about to do what you always do? Okay.
Is
I'm going to do what I always do.
the state currently meeting those requirements? I know it can change, but right now, are you analyzing?
Well,
course,
there's
they're
so many
animals.
different things that you look at, and so I'm not going to tell you that we're meeting the criteria. I'm going to tell you that we are tracking reasonably well when you look at the overall numbers for the state. I just mentioned to
We're
you that
tracking
the,
reasonably well for
percentage
phase
of
2.
positive cases is
That's,
well
to me,
enhanced,
sounds like
that
not good
the
enough.
number of hospitalizations is at the lowest it's
There
been
is
in 2
only
months and so forth.
One
Sometimes if you have
good enough.
regions of the state,
There are no degrees of being good enough. There is one. Everything else is a degree of how much you are not doing well. It's like fruit's only fresh once. After that, it has degrees of being rotten. It's the same thing.
So we're going to look at all of that. I am encouraged, but I'm not making any announcement today. That announcement will be made next week as to what the decision is. The current phase 2 order is in effect through June the 5th, which is a week from Friday. And so as I mentioned to you early next week, I hope to do it on the 1st. First is also the last day of the regular session, but we also know it's also the first day of the special session. So I think we can probably keep that timeline because I don't think it's going to be a real climactic day in terms of a lot of important legislation pending and trying to get through conference committee reports and that sort of thing. So hopefully we're going to be able to keep that day for making the announcement, which means we're going to be doing the analysis, where they're doing the analysis now. I will be receiving that analysis and the recommendation of the Department of Health over the weekend. And you will know when I make the announcement, Craig, but I appreciate your persistence on that. Yes, sir.
Governor, Friday we marked 2 weeks in our phase one. We really haven't seen any spike in cases yet. The only high numbers are those days when new labs have come online. But then again, a lot
We haven't seen any spiking yet because it hasn't been long enough.
for 2 weeks. So
We saw what happened in Texas.
time towards the end of this week where we could start seeing those spikes, or has it really been a best case scenario how it has looked?
It hasn't even been long enough.
You know, that's a great question.
Oh, that's a great question. That's politicians speak for. I don't know, and I got to make something up.
Of no less than 7 days, but 10 days, 14 days before you're going to see the cases really pick up.
So until
it yet.
we haven't seen it yet because it hasn't been 14 days.
This past weekend, Memorial Day weekend, than there have been at any time since this public health emergency started. Obviously, that causes us.
That's anecdotal data. It's from a day. It doesn't matter. You have to look at statistical averages, not what happens someday.
For the most part, because I've seen pictures.
He's just making up stuff now.
Was responsible and took care to make sure that they were abiding by the social distancing, the mask, the hygiene practices, and so forth. But we won't know. All I can tell you is, up to now, we haven't seen anything that indicates that we a surge in cases.
Yeah, we haven't seen a surge in cases but we haven't seen anything get any better either.
But otherwise,
So if things were okay, things would be getting better, and they're not. We're going to see the surge of cases very soon, just like in Texas.
19 out there. It's as contagious today as it was 2 months ago. It's as deadly today as it was 2 months ago. And so we're asking people to do what we've been talking about all along. And that's how we keep cases now, in addition to the expanded testing and the contact tracing around those test results. That's going to be really critical for us going forward.
Contact testing is a must. We need to have already started that.
Obviously, this is down the line, but he said that if we can't have LSU football as we normally do, it would be devastating.
We can't have LSU football at all.
First of all, I'm a huge Tiger fan. It would
I
be
love
devastating.
LSU football,
Um,
but there's no way to be safe for the players.
When I think about
Regardless of the stands, the players who have to play will have no way to be safe.
and sometimes I let my hopes get in the way of what objectively
They're just
would indicate is the most
Having a football season this year
outcome. But
is
I
impossible.
want to think that we're going to
It's terrible, but there should be no college football at all,
and potentially
which makes me sad.
the contact tracing.
All the contact tracing in the world won't matter. If one person on a football team gets sick after they played a team,
I doubt that
that the entire Tiger team plus the other team they paid will have to be put in quarantine. Then they're going to miss games. This could happen over and over again, depending upon how long testing was between exposure. It could be two teams that both teams have played, which has 4 teams out now. It cannot happen. Not safely. If they want to put the athletes' lives at risk for money, which something that people like to do a lot, but it's a terrible idea. We owe it to our football players and our football system and the program being so great. I know this would be a great year for the Tigers. It would be an amazing year. But it's just not going to be a year that we can play. Maybe we can delay the season. I don't know. But nobody can play football, so, there's solutions that can be made. But putting it on as it's scheduled is no possibility of occurring and being safe.
Those universities are not going to be playing football. And I don't think he said football. I think he said sports.
Yeah.
So it all goes hand in hand. And of course, the education side of the institution, as much as I love football and baseball and everything else,
Universities are about
side of the
education.
institution is obviously the reason LSU exists. And not just LSU, this is true for all of the higher education institutions
Well, all of them except for, Bible colleges.
And that will include my baby who just graduated from high school. He'll be at LSU in the fall. Leo? Funding, I haven't. Now look, funding can be cut just because revenue is down. And that's a big problem. That's part of the CARES Act funding that we have, the $1.8 billion. And you may recall.
And we can't use that money for budget shortfalls.
Sent me a letter,
The dumbest stimulus ever given to states.
Abide by the intent of the legislation, which is that 45% of the share come into the state. 45% of the 1.8 billion, almost $900 million, would be reserved for local government, and so that would be available for these fire districts and the EMS as well. The issue is you can only use this to cover expenditures
Like emergency
directly
services.
to COVID-19 and not to replace lost revenue. But there's a lot of expenditures, and for first responders, which would certainly fit here.
It does allow us to move first responder pay to other places if we can cover it under this. You have to do some creative accounting,
That's not flexibility.
but it still cannot cover the budget shortfalls. There needs to be massive amounts of stimulus without these kinds of restrictions so that we can keep everything going. We just need a few months of doing everything right, which, we have a $20 trillion economy. We'd probably spend less doing this than we would in, 3 days of Afghanistan war.
Yes, sir.
Or a day in the Iraq war.
That he doesn't think locals will be able to tap into all that $811 million. The legislature obviously wants to do something different. They want to take $200 million and give it to small businesses. Given that it doesn't seem like locals are going to be able to spend it all, why not give the $200 million to small businesses? Or do you have better vision for
Why not give it to, people instead of small businesses? They can then spend the money at small businesses, and people get things, and small businesses get customers. Never give money to business. You give money to the people who will then spend it at businesses.
CARES Act funding directly to the municipality.
I don't know why anyone thinks there should be any government subsidies for any business or any tax relief for any business at all. Give the money, then the relief to the people that are buying the products, and they will sell more of them, and they can make money by having a good business model, not by getting free tax dollars or subsidies. All that money should go to people, not business.
May or may not be possible for between now and the end of the year, because that's the time frame they have to do it, for local government to submit expenditures directly or indirectly with COVID-19 with the attestation.
Now, government does need the money.
In order to draw down that full 45%.
They're not a business. They are not there to make profit. That's why business people make such terrible politicians, because they don't understand that government's there to provide services. It's an expenditure only. There is no profit. There is no cost cutting. There is just trying to be efficient and provide public goods and services when needed.
And we have already gone through all of the CARES Act funding, but none of it will be left for local government in order to replace revenue. So that's something else that I think we have to consider. Obviously, we want to be as helpful as we can be to businesses, especially small business across the state of Louisiana.
Yeah, let's do that by giving the people stimulus money to spend at those small businesses.
I guess you could call it phase 4. It's at some point by the end of June, I think is what we were told today on the National Governors Association call. It looks like that's the timeline we're going to.
That's a terrible idea.
Bill could contain the possibility on the 1.8 billion that I just mentioned, or it could contain additional dollars for state and local governments, which could be.
We need additional dollars for everybody and that makes below $500,000 a year. Every adult should be paid $2,000 a month, and every child $1,000 a month for at least the next 3 or 4 months, so that we can all get by and
Update that, but also take into consideration
You know, fully. I don't care if that's more money for some people and less money for others. During an emergency, we treat everyone the same because we're equals. The government doesn't owe rich people more money, and it doesn't owe poor people less money. That's how we should solve this problem. It's very simple. Stimuluses paid to people are proven to work. Even the Bush stimulus of $500 was great for the economy. When you pay people, they spend the money, and that gets respent with the multiplier effect of businesses buying from their providers who provide from the original sources. And money gets spent over and over again, and taxes paid over and over again. So that $1 can be spent 5 or 6 times and taxed 5 or 6 times. But if you don't give the money to, the people, the customers, you cut out that whole great effect, and people get nothing.
Yeah, say it ain't so.
Yeah, what is your concern there, and what do you think this will do, especially when they look at the numbers and they compare it?
Yeah, well, we know that that's not true. I mean, so, for example, we can tell you just based on individuals who tested positive.
Anything the president says we know is moronic.
COVID-19 in the state of Louisiana today.
And we have the dumbest president to ever exist who just makes up things on the spot, contradicts himself consciously all the time in the same sentences, and tells people that they should inject detergents.
That's one of the things that makes it very, very difficult. And so the mask
He's a buffoon, he's corrupt,
making sure that we
and
don't have a spike
I wish we had voted no confidence so that we could vote him out.
we saw a couple of months ago. And so I really am asking people to
Never Trump. Anyone but Trump.
on this, the Department of Health guidance
Anyone
on this.
but Trump.
And of course, we're doing more than ask. If you or a
Trump is the reason this coronavirus is so bad.
business and you're coming into contact
It is his fault.
we're requiring that mask. We're strongly encouraging it for everybody else.
We should be requiring masks for anyone going into any building at all, with a $500 fine if you don't wear one, and a $1,000 fine for businesses that allow people to not wear masks.
And I will tell you that
Everybody would wear a mask real fast, because it's $6 or $500. Which are you gonna pay?
those who don't are asking for trouble. And it's not something that many people are consciously asking for, but we're
Yeah, they're consciously asking for it. They're calling masks muzzles.
or not,
In Louisiana, you can't even legally wear masks most of the time, only in cases of,
because we all
health emergencies and pandemics. Is this even legal?
many businesses that have them operating.
This is a liberty we don't normally have.
And we hope to do this over time. But as we do that, we have to do it safely. And because if you have cases spiking, then we know that people aren't going to be going out to eat. They're not going to be going to the store. They're not going
No, you don't know that. When cases spike, just as many people will go do the same stupid things they're doing now.
We've had a tremendous amount of cooperation.
Because they believe that something will save them, or they're immune, or that it's all made up. There's too many people that believe conspiracy theories to actually count on them to be responsible. I'm sorry, Mr. Governor, but that's just not true.
I have for the most part.
I wish it was, but you always remember, think of how stupid the average person is, and remember that half of all people are dumber than that. The great words of George Carlin.
When people say, well, will it come back in the fall? Well, it hadn't left.
Half of everyone you meet
This is the mother-in-law
is
of
dumber
mistakes.
than what you consider how dumb
I love my mother-in-law.
most people are.
So the point is, it has never left, and so we shouldn't talk about whether it's going to come back. I mean, it's still here, and
It's going to come back. It might get a little bit less. If it does, that will just lead to people relaxing what they do, which will cause it to come back.
Most of the 200,000 tests administered in May, as you mentioned, that was just a few days away. Is there any reason to think or maybe believe, since the state has done a good job to this point and is most likely going to reach that mark, to maybe in future months keep the goal of 200,000, or is there a chance or a
The
reason?
200,000 a month is way too low.
yeah.
Federal resources.
We should be able to test everyone in the state
First of all, the 200,000 number is a
in
number
2 or
that
3
we
months.
gave to the federal government. We gave that number to Admiral
Not
Whitmore at
4% of the population in a month.
and to all of the officials there as our testing plan. And it's not just a those tests, how much of it is mobile, how much.
And of course, all the false tests don't necessarily mean that you don't have COVID. So people actually need multiple tests if they've been exposed, believe they've been exposed, or start feeling symptoms. They need to get another test. And making that whole statistical claim out of these numbers, nonsense. That is not how statistics work. There's no margins of error, and all the numbers given are minimum numbers because they're unknown quantities that aren't being tested. You cannot do math off these silly numbers and call that to be an actual statistic. Statistics require understanding of standard deviations and margins of error, and none of those are being stated because they don't have any. I mean, they probably have a plus or minus 20% margin of error. Well, probably just a plus 20% margin of error because minus is probably like 3.
Yeah, it's a difficult question to answer definitively. We knew that first we needed to surge testing to make sure that we knew what COVID was in the state. We had done a good job. Again, we had met in April the 2%.
We have not done a good job.
Set out for states to
The
reach.
federal government's guidelines are nonsensely low.
It was not evenly distributed. We still have parishes, 3 parishes that are below 2%, and we're working really hard to get testing into those 3 parishes and bring them. So that we
And of
can
course,
see
I bet it's poor parishes that are being tested less, where there's more likely to be more virus because people in poverty seem to be the worst affected by this horrible coronavirus.
Populations where we weren't seeing enough testing. We know that the African American population bears a disproportionate burden of cases and deaths related to COVID-19. So we wanted to make sure that just as we watch percent positivity across the state, we watch percent positivity within that population. And if we're seeing a high percent positivity, we don't have enough tests in those communities, reaching people early enough to be able to actually.
No, high percent of positivity doesn't mean we have enough tests. It means that we need to do more testing, and we need to delay any more reopenings. You can't just like try and test your way out of it. Oh, let's test everybody and take all the negatives, even though they might be positives, and compare them to the positives, give no margin of error, no statistical analysis, and make up numbers. That does not work.
That's been working really well with the National Guard, who's done an outstanding job of bringing resources to communities around the state, and I'm just grateful for the women and men of the National Guard for that work. But we don't want a system in Louisiana that relies on the National Guard being activated through December 2020 to help us. So while we've been surging into those populations, we've been doing congregate testing. The other thing we've been doing is doubling down on our long-standing partnerships with community clinics, with hospitals, with federally qualified health centers that serve those communities, but early in the epidemic were not resourced with the amount of specimen collection kits that they needed. And so we are trying to
Yes,
give
we
them
don't
those
have
kits
enough
so that they can,
enough
do the specimen
swabs,
collection, setting up
long
those
Q-tips with tightly wound
if they
cotton.
collect specimens, we're not asking them to process them.
Something that costs less than a penny each,
Instead, creating
and our
partnerships,
country has run out of them.
and contracts with labs in centralized locations that we can bring those to, so that
We are in no way prepared to make these decisions.
to the governor's point, is what we want to have through December.
We haven't
2020.
gotten-
All of that is what's going to put us in a good position. So your initial
Going to
question
put us in a
is,
good,
are we
going to put us in a
to
good
do
position,
200,000
which
tests
means
by
we're in a bad
It's not
position.
here, because if COVID numbers continue to go down, if there's less COVID in the state, if people do, act as good neighbors, wash their hands, stay home.
As
if they're
numbers
sick,
go
wear
down, then they'll
masks.
stop
For
acting as good
businesses,
neighbors,
we're
and
asking
it'll
them
go
to
up.
protect their employees by
Because
wearing masks, protect
Louisianians,
their employees by
you know,
asking
are
them
hard-headed.
to wear
At
masks
least half of
when
us.
they come in. If all of that
Probably
happens,
more.
We should see cases continue to go down. And then arbitrarily testing 200,000 people doesn't make sense. What we want to have, if we need it, is the capacity to do 200,000 or more. And we continue to build that
We need to have the capacity to do 1 million in a month, so we can test everybody
And it's not something that's
over and over
it's a
again
capacity that we're building
till the end of the year at least.
through the coming months, because we need to be prepared for whatever comes.
Question for you, on the congregate settings, do you have an update on how many crawfish farms have now had clusters of coronavirus? You said last week there was
Ooh, crawfish farm coronavirus? That sounds terrible.
workers in these facilities and testing positive.
So I do not.
And will you ever have an update on that? You obviously you give these numbers.
You would think you'd have the seafood industry a little bit better known than that. One of our most important industries with one of the highest multiplier effects in the economy.
A situation in which we are giving every cluster in the state reports, I think would be
The
challenging.
seafood
frankly,
industry
for
has
public health
a
to manage.
8x multiplier effect per dollar invested into it.
In the context of nursing
Nothing
homes,
in this state, not even oil, reaches those kind of levels.
like the nursing homes report, we are reporting the data that the federal government, or some of the data that the federal government.
We're not going to know how many people in nursing homes have been affected yet.
We talk about other.
Yeah, but I guess I feel like it's hard to
settings, on our dashboard as adult residential facilities. Give those
I'm
numbers
very
aggregate,
disappointed with
but
this
for
press
businesses,
conference.
we do not,
This is placating people.
providing those,
This is not
data
trying
on
to
the website or
actually reach
and
a
again,
better
that is
conclusion.
The reason for that, because I want to be clear, I had the opportunity to say this in the Senate Governmental Affairs Committee, and I'll repeat it here for the general public. The Office of Public Health takes transparency
It's
very
the only
seriously.
Art
It's something that
Deco
we've been,
Capitol building in
really
the United
striving
States.
to achieve since the beginning of this outbreak under the guidance
It's
of
really
the
neat.
governor.
There-
Made it clear from
Very
day one,
few are made
look,
with
we
all
may
this
not know
extra
everything, we need to be
effort
clear about what
and
we know
beauty.
now. Let's be transparent about that, and as we do know things, share that as well. So that's our watch.
I'll have to cut that part out when I do the video, or leave it in. They were nice people.
With public health, our main mandate is to protect and promote the health of all Louisianans and the communities across the state. And one of the ways to do that is to ensure that anybody that has symptoms of COVID or any
I'm sorry, the historian in me comes out sometimes.
have symptoms of COVID, feel
You got to let
comfortable
people
and
know the
in fact
cool
feel
things
encouraged to come
that we do
forward
have in our
to the
state.
Department of Health, to the Office of Public Health, and alert us to that fact, because we cannot
This
serve
guy is
those
not saying
communities, those
anything with as many
individuals,
words as possible.
without them feeling that they can freely come to us. And so that's why Louisiana and many states give that protection and do not.
You could have said all this in like one sentence, dude.
Related to those outbreaks, if they do not present
Somebody
a
likes
risk
just
to
hearing
the
themselves
public,
talk.
rest assured,
I get that. I love hearing myself talk. I talk to a camera that no one's around all the time. That's my job.
the aggregate number
But
for all
you got a-
workplaces is
you got an
essentially,
audience.
in our overall case number. What we don't have is the ability to say, here's business-related cases, here's non-business related cases. And I think
Does
where
business
your
related
question might
include
lead us is
churches?
starting to
Or are
make
you saying
arbitrary
non-business
decisions
related
about which
cases? That's
businesses we want to
churches.
report on or not. And I don't think that makes sense from a public health standpoint. There are certain communities that we do think, certainly because of federal regulations and state regulations, and the
To watch the full
particular
press
risk,
conference,
those
it's being
groups
broadcast by
present, like
LTV,
nursing
and I'm
homes,
sure they'll have it on their site for
rise
watching.
level. But again,
If you wanna
we
see
want
everything without my
situations every
commentary,
business, especially now as
I'll
we
try and add a link
engaging sectors
in
of
the
economy,
description
feels that they
to
would
the
have any incentive
original
to hide
video.
cases from us. Because first and foremost, my job for the state, for all of you, is getting control over COVID, is identifying those cases, working with the organizations where the people who have COVID are, whether they're employees or residents, and serving them.
Residents are employees.
By, trying to get control over the outbreak and making.
He's
life
just
as easy
saying
as
words.
possible.
The last one?
Another one for you.
Okay.
How many nursing homes and other facilities is the state? Because I understand the state has a role in helping places that can't, don't have the capacity to test everyone. How many places has the state gone into and helped them test all their residents and staff?
Yeah, so
Oh,
I don't have that number off the top of my head. I'll say
of course you don't, because it's probably none.
3 different groups, which is one of the reasons I wouldn't have that number.
3 different
One is,
groups.
most
Again,
nursing
lack
homes
of
across the state have
federalism
told us, we're
leads
interested in
to
testing, but like those federal health
unorganized,
centers or other clinics I was
mismanaged
talking about earlier,
protocols
we just don't have
differing
the kits.
across
So one of the
places,
things that our regional medical
and
directors
nobody
do
knows
is
what's
making
going on.
sure that they have the supplies needed to collect specimens. Nursing homes have medical directors, have medical teams able to do that work.
Yes,
were
they
so
just don't have the
surprised.
supplies to
So
do
a
it.
large group, are doing that testing without needing much more support from us.
I could give this guy speech before he finishes saying it.
From the federal government, as well as relationships we're building with labs that have their own kits around the state.
Oh, wow.
Another group are facilities that are asking for help because there's maybe more than their medical teams feel that they can control, or they're just looking for the best practices in testing, and so we have that ability to go in and help with testing, especially if they're.
It shouldn't be
if there's
having to help with
constraints
testing.
on
Y'all
time
should be
tests.
doing
So,
all the
staff
testing.
time.
Should be 100% funded by the federal government, paid to the states, well, and then y'all should be testing every nursing home and assisted living facility.
In infection control assessment.
and
response.
on a regular basis.
Comprehensive CDC develops,
It should not have to be paid for by these places.
what are the procedures in place? Who might
This
be
is an
testing?
easy thing that we
What are
should be
the
prepared for,
levels that you have on-
and our country is
what-
not. We are the richest country in the world per person
reduced, run,
by a lot.
dining, all those kinds of,
Why can't we
issues that
have,
make sure every nurse
you know, some plastic tubes
especially as they have cases or
and some really long Q-tips? Basically, I'm oversimplifying those sterile medical supplies, but we're still costing the pennies. So it's just manpower to get it out. But why we have manpower, but we don't have the medical supplies that cost pennies that are going for ridiculous amounts of money now. All of which should be purchased by FEMA and distributed to states as needed, and no state should have to buy any of it.
Thank you. Also, we will be back at this location Friday at 2:30 p.m.
Friday at 2:30 for the next governor's press conference. I'll be covering that too.
We have made tremendous progress over the last couple of months, and it's a result of their compliance, with their patience, and
No, it's a result of their protests and complaining.
We do remain in phase one, and
Yes, and remember, we're still in phase one.
go into phase two as we are
Trump did not allow the churches to become essential. He's still limited to 25%. Nothing has changed.
just don't know what the announcement will be.
All those internet conspiracies,
So thank you.
the governor just confirmed they're all conspiracies.
Undeterred, the young male keeps trying his luck.
Undeterred, the young male keeps trying his luck. That was a really funny thing for that to go to. Oh, well, thank y'all for watching. That's my take on the Louisiana Governor's press conference. I'll be linking the full press conference without my commentary. Probably not right when this is published, because I'm going to do that now, but soon. This has been a Trey Bennett production. Y'all have a wonderful afternoon.